So my name is David Fawcett. I work at RADIANT Dental Implant Centre in Enniskillen. I've been working here since 2010. My interests in dentistry are general restorative, but also orthodontics as well. I like using aligner systems with my patients. I do some fixed as well, but more and more I'm using aligners where I can. So I had been providing aligner treatments to my patients using other systems before coming onto the TrioClear platform, and for better or worse, each system has its own, good points and bad points. But I'd been getting a little bit frustrated with the system I had been using, and I was shopping around thinking, right, who am I going to go to next? And I've always used Southern Cross dental products since I graduated, whether it be crown bridge, prosthetic, bite guards, whatever. I've always been very, very happy with the level of service that I have had from them as a lab. So I thought, well, I'll not pass them by. I did a bit of Googling and realised they provide their own aligners, and I thought, well, I'll reach out and see what they can do. And I was just so impressed with the level of service, communication, everything that I got from them. I thought, right, that'll do for me, and everything's been great since, and I wouldn't use anyone else. So the biggest thing I like about TrioClear is, to be honest, the local point of contact that I have. Really good open lines of communication with the team. Very quick turnaround on treatment plans, especially now that in the practice we're fully digital. Treatment plans come back so quickly, refinements to the treatment plans come back so quickly, and then the actual, once you click approve, actually me having the product in hand that I can give to a patient is a very quick turnaround time. If there's any support, any issues that I need going through a treatment, it's just there. You don't have to jump through any hoops to get it. So it gives me a great confidence when I'm treating my patients that I've got a team behind me that's with me, and if we're all working towards the same end goal. The quality of the product, when it actually comes back, so well presented. I've worked with aligner companies in the past where the product you actually receive is, it's embarrassing sometimes, the packaging, everything. This feels like a really premium product that you're giving to your patients, and I just think that's what you want. From a cost-effectiveness point of view, the lab bill is a lot less than some of the high-end providers or some of the most commonly known brands, but that in no way reflects the quality of the product you're getting. So you can charge your patients a fair and competitive price, and case acceptance is so much higher for that reason. So the iDesign software I find is very intuitive, very easy to use, very, very clear, graphics and everything, just very nicely done. It's a very easy to manipulate tool, and a great communication tool for patients, and showing them where we're going with treatment and reassuring them that when we're going through treatment that actually we're on track. Sometimes they might think, oh, I'm not seeing much, but actually when you bring them to the stage in the software of where they're supposed to be at, it all tallies 99% of the time. So, and it's just such an easy interface to use. I love it, it's great. Would I recommend TrioClear? Absolutely, and I have done. I know that there's colleagues in this practice probably don't do as much of it as I do, but it has become their go-to provider as well. I would have absolutely no hesitancy in recommending it to any dental professional wanting to use aligners. There's nothing. It does exactly what it's supposed to do in a cost-effective manner with great service. So, what more do you want? For a dentist who's maybe contemplating getting into clear aligner therapy, I would say to them, take your time, get into it, make sure you have the right people alongside you who are going to help you. Start simple. Sometimes it's difficult to actually know what a simple case is and what a simple case isn't, and with regards Southern Cross, TrioClear, take a scan, take an impression, you'll get the help that's there, and they'll walk you through the case. They'll let you know if it's a simple case, they'll let you know if it's a case that's beyond the scope of what maybe you would be able to do. But once you get into the workflow of it, it's a very nice workflow. I would advise anyone to get into it. There's a big market out there as well. If you're not providing aligner treatments, you're missing out a little bit. Nice work. It leads to whitening, it leads to other cosmetic dentistry that you might want to do as well. So I just say go for it. So I had fixed upper and lower orthodontic treatment as a teenager, but as I've gone through my 20s and 30s, my lower, like a lot of people, lower incisor crowding had relapsed and just got worse to the point where I really needed to get something done. One of my incisors was very in-standing and it was just starting to cause problems. So I have undergone aligner treatment on my lower arch only, just to realign everything down there. Wearing them, very comfortable. I would forget that I actually have them on, and patients don't know. When I'm talking to them about aligner treatment and I say to them I'm actually wearing them at the minute, they're always very surprised. So extremely comfortable. Within a day or two of getting used to wearing them, you'd forget that they're there. So if I hit play on the simulation here, you'll just see the way the teeth are moving as I go through the treatment. I'm currently on about aligner 15, which is around about here. So I've still got a little bit of work to do on this lower left too. You can see where IPR has been performed just to create space and allow the teeth to move. Just run that again. You can really see just how everything's coming together. I think we'll have just a very nice result at the end of it. So the soft aligner that you start off with, it gives you a really good introduction to the treatment. There is quite a discernible difference between the soft and the hard. But going in with the soft, it just gets things going very nicely. Very comfortable. Much easier even to get in and out than the hard one. So my experience as a patient and then as a dentist treating patients is that it's very well received at the start. Very comfortable. Just begins to get the ball rolling nicely. If someone's considering getting clear aligner therapy, it's a very personal choice. Everyone's motivations will be different, but generally they're seeking some sort of cosmetic improvement to their teeth. And the teeth aren't just a functional part of our body. They have a huge role in terms of how we feel about our self-esteem and everything as well, and that's very important. And clear aligner therapy can make a big difference to people's lives. If you've overlapping teeth or something and they've always stopped you from smiling, well, that's going to have implications on your quality of life. We're all entitled and should enjoy our lives, and clear aligner therapy has a role to play in that. So my advice is to, if someone's considering it, speak to the dentist, open that conversation up and see what might be possible.